Understanding Addiction Psychiatry and Ketamine Therapy, featuring Dr. Mark Hrymoc. Join us for an eye-opening conversation with Dr. Mark Hrymoc, an addiction psychiatrist with 6 years of experience in ketamine therapy. In this episode, Dr. Hrymoc challenges common misconceptions about addiction and psychiatric treatment, explaining how addiction affects willpower rather than representing a failure of it. We explore the fascinating evolution of ketamine from anesthetic and club drug to a breakthrough treatment for treatment-resistant depression, and why it works faster than conventional antidepressants while uniquely reducing suicidal thinking. Dr. Hrymoc emphasizes the importance of comprehensive psychiatric evaluation over gas and go ketamine administration and advocates for treating substance use and underlying mental health issues simultaneously rather than sequentially. This conversation dives deep into the intersection of adding medicine and innovative psychiatric treatments, while highlighting the critical need to reduce shame and stigma to encourage people to seek professional help. Whether you're struggling with addiction, supporting someone who is, or simply interested in cutting-edge mental health treatments, this episode offers valuable insights into the future of addiction recovery. Dr. Hrymoc has extensive expertise in the psychopharmacology of addiction and other mental health disorders. He is double board certified in general psychiatry and addiction psychiatry and was previously board certified in addiction medicine. Dr. Hrymoc previously held the positions of assistant clinical professor of psychiatry at UCLA, where he supervised training psychiatrists at their addiction psychiatry clinic. He completed his subspecialist training in addiction psychiatry at Cedars-Sinai Medical Center in Los Angeles and currently serves as a consulting physician to several prestigious drug and alcohol treatment centers in the area. In addition to his clinical work, Dr. Hrymoc continues to be active in the local addiction treatment community. In September 2008, he founded Perspectives on Addiction, an interdisciplinary educational group for addiction professionals in Los Angeles. Dr. Hrymoc has served as a representative of the states of California, Alaska, and Hawaii to the American Academy of Addiction Psychiatry and was a member of the Education Committee of the California Society of Addiction Medicine. Dr. Hrymoc co-authored a chapter in Principles of Addiction Medicine, the main textbook of the American Society of Addiction Medicine, and has been published in several academic journals. To learn more about our guests, you can visit our podcast notes and find links to connect with Dr. Mark Hrymoc.
This is Talking Addiction and Recovery, the podcast talking, you guessed it, all about addiction and recovery. Join your host, licensed professional counselor Andrew J. Schreier, as he and his guests break down recovery topics with raw honesty, delving into niche conversations around the topics of substance abuse, mental health, and gambling. We intend to meet individuals where they are on their own personal journey of recovery, with dignity, respect, and compassion. We'll do more than talk addiction and recovery. We'll explore it. We're glad you've joined us. Here with today's episode, your host, Andrew Schreier.
On this episode of Talking Addiction and Recovery, we want to welcome Dr. Mark Hrymoc. Thanks for joining.
Yeah, thanks for having me.
Yeah. Can you tell the audience a little bit about yourself?
Sure. I'm a psychiatrist. I specialize in addiction. I also work with ketamine. We've been doing that in our practice for 6 years now. So I do a lot of things having to do with mental health, particularly medications, whether it's general psychiatry or addiction psychiatry or ketamine treatment.
Amazing. Thanks. We're going to talk about the ketamine, but I also want to start with what got you interested in addiction work, but also addiction psychiatry? Because I don't think that's something that is talked about as much as other areas of treating addiction. So can you talk about getting into addiction in general, but then also the part of psychiatry?
Yeah, I was just my first interest was just general psychiatry and psychology. I was a psychology major in college. I was just always fascinated with people and the way they think and why they do the things that they do. As is common for people going into the field, a lot of it also was just, personal journey I was on and figuring out what I wanted to do with myself and what meant anything to me in life. But then addiction specifically fascinated me because I saw it as on the outside, looking like something that a person can just stop. It seems like it should be simple just to stop doing something if it's leading to negative consequences. But yet there were many people, some within my family, some, friends, I mean, addictions everywhere. And yeah, at the time I was in high school, I mean, there were big stories of like just mental health issues involving substances like Kurt Cobain and things like that too. So, I just saw it as a big problem that really took people off of what otherwise would be a great trajectory in life and really can bring people to their knees, families to their knees. And if they can address it, wonderful turnaround stories are possible. So, I found it also as a field where, there's a lot of reward with taking someone from a really bad place to a really good place, especially in a pretty short amount of time, months often.
Sounds like you had like a compassionate curiosity towards like it seems simple of like why can't you just stop or why doesn't someone stop? But you wanted to actually more know about what was going on behind all that, like inside what was happening. Is
Yeah,
that
yeah. I mean, I think it looks that way to many people who aren't in the field, very often to families, and they're just, pulling their hair out, like, why is, my loved one keep drinking when they can see the pain that it causes and all that. So yeah, it turns out there is a lot more beneath the surface, and it's a complicated, thorny issue, but also not an impossible one. So there's, definitely a big story of hope there that I really want people to know about too.
that's great. And can you talk about psychiatry? Because I think this is a fascinating thing to bring up because I don't think most people understand necessarily what the psychiatry aspect of it or what the purpose is. So can you give listeners just a little bit of what the psychiatry is and the approach it would take with something like addiction?
Yeah, psychiatry in its simplest sense is the field of medicine that has to do with people's thoughts and behaviors. So it's not neurology, which is looking more at the brain and nervous system as like, physical structures and the conditions that affect those. But it's mood issues, so like depression, anxiety, insomnia, or substance issues. That's are specifically in the subspecialty of addiction psychiatry. In back in the day when it first started, it really involved mainly psychotherapy, medications being used to treat people didn't really start coming out until the 50s and 60s. And so, Sigmund Freud and Carl Jung and big psychoanalysts like that, we'd say, are, the folks that spawned modern psychiatry. And then all the treatments was talk therapy. But then, yeah, medications in the 50s and 60s started coming around, and with each decade, there was just like the exponential growth in medication options. And so, with time, especially where things are now, psychiatry usually implies medication treatment because psychotherapy is there. There are also psychotherapists and psychologists that don't work with medications, but they do the talk therapy part of things. And so that's an important distinguish too. Many people mix up, what's a psychologist versus psychiatrist. So
I love
yeah.
that because I think sometimes people don't, you know, psychiatrist, psychologist, therapist, counselor, like there's so many different fields of this and how it all works. So that's why I'm really great to have you on and talk about that in particular because I don't think it's kind of talked about enough with that. So I have a really important question with medicine because I see this most in areas of addiction more than areas of mental health or even with physical health issues where the idea of not being on anything, just not taking a single thing at all, I think that becomes sort of like the narrative or the push or that's how it's supposed to be. How do you talk with individuals when you're treating addiction about just medicine in general or the role of medication? Because I see that more of a challenge in addiction than if I'm working with someone in mental health or even with physical health. It seems like it's more of, yeah, I've got this issue and I go to the doctor and I get this medication. It helps with that. Even mental health, I see a little bit more of a struggle because there might be, yeah, it helps me to feel this way, but I don't want to be on it forever. I don't want to.
Right.
But addiction, I see most often where there's a lot of barriers or reluctance because of some of the notion of shouldn't be on it. It means you can't be on anything. If you're on it, it's a substance. Like there's so much of this talk around medication with addiction. So how do you manage those conversations? Because I imagine they happen quite a bit.
Yeah, no, definitely a lot. I mean, honestly, I have some version of this discussion a few times a day, every day. So, there's a lot of stigma about psychiatric medications and in general mental health treatment. People are reluctant to admit that they have an issue that they're seeking out professional help for, and even therapy has some stigma against it. People often wait until they wait too long is sort of the rule, not the exception, before seeking help. And addiction psychiatry is no different. Yeah, you use the word should, so whenever I hear the word should, that, my ears perk up. That implies like a value judgment where there's an opportunity to evaluate, is that value system that you're describing by using that word should really true, really what would be helpful for you to believe, or that you want to believe, so challenging that belief, I think, is important. Um, Mental health issues are as much medical issues as physical health issues. So as you pointed out, if someone has a rash on their arm, they go to a doctor, they want a medicine to address it right away, and they'll gladly take it, or if they have blood pressure issues or like a seizure disorder, they want to be taking a medicine to prevent, serious health consequences of whatever their condition is. Depression, anxiety, bipolar disorder, those all run in families too. ADHD, the most heritable actually of all the conditions. And substance issues are actually more heritable, more likely to be inherited than even general mental health issues. The stat is 60% genes and 40% environment for treatment of substance issues. So, it makes sense that like some biologically based treatment is going to help too, not only the therapy and the meetings, like the things that get a person thinking about their substance issue, but some medication part of treatment gives the best result. So, they often will have depression or anxiety, some underlying condition that they're self-medicating with their substance. So, treating that with medications is often helpful, especially if they've tried the therapy or meetings route and it hasn't really helped fully. Um, and the medications can also, they're also anti-craving medicines, medicines that can actually reduce a person's craving for alcohol, let's say, or nicotine, opioids. Those tend to be the substance classes where there are the best like medication-based treatments.
Yeah. How
Yeah.
do we get to a spot where, 'cause I think people still like the mind, we still don't think about it as the body, even though like there's a brain and we know all the there's still like this idea that you can like think through it or you can like will yourself through it,
Right.
but yet when you're dealing with a different part of your body, there's this other acceptance that like I just can't, like I have type 1 diabetes. I know I need insulin. I know that no matter how much working out I do or how much eating I manage, like I don't have a pancreas that functions at all anymore. Like it's
Hmm.
been that way. So to me, I don't struggle with knowing that I need that, and without it, life would be really hard for me, right? Big challenge. But sometimes we just forget that the mind is part of the body, that it is just like, I mean, it's not the same as every other body part organ, but it is still a part of our body. And then we try to separate it by either thinking we can will ourselves to something or we can overthink it. Like, how do we bridge that gap to helping people understand more about the connection that it has and the things that we do need to treat? Like when you say there is parts of it that come from genetics and biology, that then part of it is how we know to treat it when it comes from some of those areas.
Yeah, it's not just willpower. If all it required was willpower, then we wouldn't call it an addiction and people wouldn't be seeking help for it. They would just be able to, snap their way into that way of thinking. In fact, a phrasing conceptualization of addiction that I like is that it's a condition that affects a person's willpower. The salience or the importance of a certain substance starts to grow, and other things that are healthy for a person to be engaged in, like, family responsibilities or their own health or their own, work or ability to take care of themselves, starts to go down, and this substance hijacks their motivational circuitry and makes them more motivated to seek out that substance than to get a good breakfast and get the day started and do other things, including having good relationships with people. So addiction in its final stages often includes a person just being isolated and non-functional. So yeah,
Be-
it's a lot more than willpower.
Because you treat, addiction and mental health, I do want to ask you, because this is going back to some of the age-old debate from academics of, well, is it this or this? Did this cause this? This cause that? If you treat this, then this will get better, or do you treat this and then hope like, this still gets talked about. So how do you approach when you're working with an individual with substance use and mental health on, because sometimes people say like, well, when you stop the using, then the mental health will get better and it will no longer be that way. Or like if you address the mental health, then there's going to be no need to take the substance. It sounds a little bit too easy to just simply say that's how we address the issues. So how do
Right.
you approach someone who is experiencing both or several, and how to begin to work with them on what this treatment or how this is going to begin to help them or be a part of their journey?
Yeah, we address both simultaneously is the answer. A lot of times addiction springs up because it's the person's best solo attempt at addressing some mental health issue, like drinking to get to sleep because you have insomnia, then turns into a regular thing. And alcohol, yeah, the substances that people use are not the best medications for the conditions, and they're often effective on a short-term level, and that's why people even start and they even continue for the first few weeks or months. But using the example of alcohol, tolerance is quickly acquired. Also, like one drink only lasts an hour, so that results in the quote need for a person to, keep drinking if they want to have that effect that they're going after. But, the more they do it, the less effect that same amount of alcohol has, and so they need to raise their drinking. And so, yeah, seeing a situation like that, addressing both first means detoxing them off of that substance, and so like with alcohol, opioids, there's often a medication component to just the detox part of it. But then I would give them non-addictive medicines that are ultimately going to be more effective and also safer to address the insomnia that is inevitably going to come up if we take alcohol out of the picture. But then those will be medicines that can be sustainable in the long term, and they won't have the same downside and things like that. So, we address both that way. Alcohol is a depressant too, so there's some amount of depression that can actually come from alcohol, even though like in the short term it's a mood booster, like chronic use can actually lead to depression. And so, once a person's especially been sober for a few months, if they still struggle with depression, then we might consider treatments for that, which could be therapy, could be medications. I mean, I'm not coming in with any sort of kind of agenda to prescribe medications for everyone for everything, and medications are not always the best answer. And human nature also is such that people don't want to be on medicines long term if they don't need to be. And I'm also able to talk with patients about that too.
Yeah, that's great. I want to talk to you about ketamine therapy. You mentioned, I think, 6 years. Is that right? 6-ish years?
Yeah, that
Yeah.
we've been running the ketamine program. Yep.
Yeah. So it's, ketamine has been talked about a lot lately, seeing it more, when I'm at conferences, I'm seeing more breakout sessions about ketamine. I'm seeing more, webinars and people talking about it. It's really in a different spot today than it was just a few years ago, like not too long ago. So, can you just share a little bit about what got you interested in ketamine and then sort of talk about like what it is that you provide, with the services that you do? Because I think there's still a lot that people don't, they're hearing a lot about ketamine, but people might not know a lot about it or how it works and why are we hearing more about it now, especially those who might not be in the field like we are, who are attending conferences and breakouts and hearing all this. Like someone is, I hear a lot about it, but I really have no idea what it is. So, can you dive into that a little bit? Because I think that's a great topic.
Sure. Yeah, what got me interested in it was just working in the field of general and addiction psychiatry, where we encounter a lot of people with depression that responds to conventional treatments, but not always and or not to the degree that we would like. There's just maybe some benefit, but not enough. They're still significantly impaired from their depression. And so either the field in general is needed more options for treatment-resistant depression. And ketamine started being used in the early 2000s. First in research has been demonstrated to have an effect, but especially like in 2012, 2014, it just became clear that ketamine was also a fast-acting antidepressant that was well tolerated and had a higher success rate than yet another conventional antidepressant pill for a person. And so it is a potent antidepressant. It works quickly. It also helps reduce thoughts of self-harm, which ironically no other antidepressant has been shown to have. Antidepressants have been shown to treat depression and improve quality of life and functioning, but specifically suicidal thinking or suicidal behaviors are not decreased with conventional antidepressants. And so, ketamine definitely has proven itself in research studies as being a good tool for that. And also, pharmaceutical drug development has reached a point of stagnation. There's not really a lot of new medications being developed. It seems like the medicines that target serotonin, norepinephrine, dopamine, there's a lot of like Me Too drugs that have kind of come out, but little new innovation. Until really like in the last decade, there's been a lot of interest about psychedelics being potentially a new chapter in psychiatry, a type of treatment that is just, comes at the issues from a different angle. And it could include psychotherapy or does not. So that also is, really interesting to me that, there could be a medication that a person takes that may actually make them more able to respond to talk therapy. Maybe they're more able to think about themselves and their lives in a different way, able to address even like recurring patterns without like always hitting it from the same angle, like maybe coming at it from like a quote more objective way or something like that with the benefit of a different perspective that these medicines can bring. So, that's really kind of what sparked my interest and inspired me to get into the field. There are other treatments for treatment-resistant depression are TMS, transcranial magnetic stimulation. There are a lot of clinics for that. I wasn't really interested in kind of doing something like that. And then there's ECT, electroconvulsive therapy, also known as shock therapy. Still effective. People are surprised to hear that, it's still done sometimes, but it is a heavy duty treatment. And
And much different than when it first came out, right?
yes,
Yeah, like that's another thing that it's not
yes.
what, um it was when it first came out. So I'm glad you talked about those other things because I know those are also other ones
Mhm.
that are growing. How did ketamine now get to where it is? Because ketamine itself is not new, right? Like this isn't like we
Yeah.
just discovered it. And I remember like so I've been a counselor in the field now like 20 plus years. I remember like when I first learned about like my textbook of like drugs, right? Like learn about the drugs and ketamine would be talked about, but more so as like a drug that would be like misused or a drug that would be um and then but you didn't really see that a lot. To be honest, that wasn't something that I saw a lot in my career as a counselor, is people seeing me because they are using ketamine socially, recreationally, or having problems with it. So like it was one that like we knew about, but it was sort of talked about as in this is a drug to be aware of, but it's one that you're not really seeing that much. It kind of seemed like it went away. It seemed like it wasn't even being talked about much. And then all of a sudden we're hearing about it as a treatment. We're hearing about it at so can you give any background on like how it went from like we've known about it, it
Yeah.
was described this way, but then all of a sudden now we're here because I think that's some part of the people are kind of like what or like wait the same thing that I heard about way back before. How do we get to this point?
Yeah. Yeah. And, yeah, it was FDA approved in 1970, mainly as a anesthetic in surgeries. It is considered a dissociative medication and also has been found to treat certain pain disorders. So it is given for CRPS, complex regional pain syndrome. There are IV intravenous infusions that are given for that. There are even certain creams that people make with ketamine as one of the components for nerve pain. So yeah, for 30 plus years, its main use in the US and around the world, it was really for pain and anesthesia applications. And then in the early 2000s, studies started coming out about it being effective for the treatment of depression. So, that was when it started being, offered as a treatment. Yeah, I agree. I had that same sort of education about like the class of drugs. It's in the club drug class in with like MDMA and GHB and
Yeah,
things like
right.
that that
Yeah.
people might use to party with and clubs. And that is a side of it too. And as you pointed out too, it's rarely someone's drug of choice, right? I could tell you just in my general work with addiction it's usually opioids or alcohol. That's really like 80% of what people ever get addicted to. Alcohol even more commonly just because of availability. And even the stimulants, cocaine, methamphetamine might be like 10%. But yeah, I rarely saw someone whose like primary drug of choice was ketamine, or for that matter, like any other psychedelic, hallucinogen.
It was mostly like they
Um,
tried it. Like when I do a drug history or I asked about like, hey, have you tried this, done this? And
yeah,
when I would come across those, someone might be like, I tried that a couple times, maybe here and there, or it may have been like but you're right. It was never the thing that was like, this is why I'm here. This is why
right.
I'm in treatment. This is why I'm having some issues or problems. So it was there, but then it really wasn't much there. And then we kind of like forgot about it until now here we're in this different part.
Yeah, yeah. And I think just because it helped a lot of people and it's also a unique concept, so it got a lot of media attention and um it's also just well tolerated, requires 6 treatments. If we look at like the other it's like TMS, other options, that's like 30 to 35 treatments. It's just a lot more of like a commitment to it. And, it has side effects of, feeling warm and pleasant and, themes of peace and love and things like that, are actually positive side effects that can also be a part of the reason that people are interested in, this treatment too. But and yeah, there's a lot of reason to think that therapy combined with it can also help folks. A lot of times they'll block out certain things. They won't want to think about things, and that even keeps them stuck. But yeah, with ketamine, they can hopefully address issues that otherwise they'd find it difficult to.
Do you see people seeking out ketamine or ketamine therapy or just some way of including it, or do you most often see someone who's been trying something else, so they've been using something else to try and they just nothing seems to work and then it's introduced to them? Like how does this even get brought up in, because it's not a very common thing, more common now, but it's not something that is,
Yeah,
so like how does that get presented or how does that normally show up in like the work that you do?
right. Yeah, the most common way that people come to us is they're seeing a doctor, whether it's a primary care doc or a psychiatrist that is trying to treat their depression with medications and hasn't responded adequately, or yeah, their therapist is, referring them to us for treatment. So I'd say 80 to 90% are coming at the recommendation of another professional in the community. And yeah, there might be 5 or 10% of people that just like on their own, they start doing research and maybe for not even great reasons, they never tried any conventional treatments, but they come to us, because they've heard about this treatment and it sounds like maybe more appealing. It offers the option of a treatment that you get, but you don't have to stay on a regular medication, so like that stigma could be even pushing people in the direction of ketamine because it's just like a short-term sort of treatment. And yeah, it's true that it can help people and they may not need to take a medication in the long term. One of the things that we do in our clinic and we pride ourselves on is actually giving like a full psychiatric evaluation and not just only giving them the treatment that they're asking for, but also saying, and I noticed that you have this anxiety and or these panic attacks, that you're describing, or this insomnia can also be treated in these other ways. And so I do think it's important to do a full psychiatric evaluation and just give them the whole picture. And, ketamine, while very helpful, is rarely like the only treatment, especially if it's for the severity of treatments that usually people are seeking out ketamine to treat.
I think some one thing I'd like to clear up is I think some people think they see like ketamine, um, more places doing it. They see it kind of like popping up here a little bit more. I will say it almost became like when we saw not to the extent, but like the CBD stores started popping up open and seemed to be a lot going on. And I think some people don't fully understand the process with ketamine because I think some people are thinking like it's just like an IV place where you just kind of, like when you go to those liquid IV places and you can sit down and get something done for an hour. And I think some people think like that's how it works, where you just walk in and you do this and then all of a sudden you get it. But there's a process to all this. Or like how does this kind of work for someone? Because you do all this evaluation, you do all these things. But I think there's like this narrative or this stigma even that people just walk in and say I want this and sit down, get it, and that's it.
Yeah, that phrase, like the gas and go ketamine clinic, like as if you're like tanking up your car with gas, is the exact opposite of what I think it should be. It is a real treatment. It's a psychiatric treatment. We're trying to treat like actual psychiatric conditions. Yeah, a lot of ketamine clinics sprang up because it is a not covered by insurance and it's a lot easier and less stressful than what a lot of the docs that are prescribing ketamine, like in their ordinary jobs. Like if you think about like emergency room physicians or anesthesiologists that traditionally in medicine have the most experience in working with ketamine, they were the ones that were opening, I'd say 90% of ketamine clinics, especially like 10 years ago. There was Spravato, which was FDA approved in 2019. It's the first FDA approved form of ketamine, happens to be an inhaled form of ketamine. So to me, that's when ketamine really established true legitimacy within psychiatry. Before that, it was seen as, like this kind of cash pay clinic that a lot of ER docs and anesthesiologists were doing, but not like a real psychiatric treatment. And even in research, they were looking for meds that were similar to ketamine, but would not have like the dissociative aspect or raise heart rate or blood pressure. Like, maybe it's something that could come in a pill instead of an IV because that's sort of burdensome to give to people. But it was 2019 that it just became clear like there's no analogs coming out. Ketamine is going to be the treatment in this category, and that's what inspired me to literally start it in 2019 when Spravato became FDA approved.
And I noticed on the website there was music for ketamine therapy sessions. And
Hmm.
I found that fascinating because I it's always amazing the things that we know people connect to, like laughter, humor, movies, and yet sometimes those things weren't always seen as serious as far as treatment or interventions for certain things, right? Like I
Yep.
remember I worked in a group home and sometimes I remember watching a movie and talking about it with the kids because I work with 12 to 17-year-olds. Well, sometimes some of our best discussions, but also sometimes playing a movie doesn't look like you're doing the CBT and we had to make it work sometimes, right? We had to throw in there how we were going to do it. So I
Hmm.
saw here like the music for the ketamine therapy is something that's really outlined as a session. So Q, and it looks like a little Spotify profiles you got going on
Yep.
for it. So how did that get to be such a thing to stand out as a
Yeah.
service?
Yeah, because it's a treatment that has a biological aspect, but also an experiential one. The person literally goes on a mental journey when they get the treatment. Uh, one of the big sayings in psychedelic medicine in general is set and setting are vital. So set being like your mindset walking into the treatment. And that's also why we encourage people to like set an intention, something that you want to work on or think about, like when you're getting your treatment. Um, and also setting like the physical space. And that's our job to, create a professional, supportive environment where, it's suitable for an IV being administered, so like medically safe, but also, yeah, psychologically safe. And why not also make it pleasant too, And so, I mean, yeah, music, is this nonverbal, often, used as a treatment too in other cultures. This is going outside of like Western medicine, but, if we think about music's power to, lift spirits and to unite people. There's a lot of that's possible that's not studied or talked about in the Western model of medicine, but it's something that could be maximized and optimized. And so, yeah, my standard recommendation for choosing music is, something that you like, something that doesn't have heavy beats or vocals or themes. Like we don't want you kind of like the equivalent of being on a roller coaster car that goes down like a specific track, even if you think you need that or you think, it's good for you. Like actually what we want is more like free form music that could even be like a background to a good experience. And then, you kind of just follow where the medicine takes you and where your mind takes you, and so um, and music can help structure and help a person have a better experience of their session too.
Yeah, I was thinking like when I don't listen to music anymore when I do ultra trail running and I used to listen to music. I don't anymore. Um, but when I used to, I'd be like, I'm not gonna try and listen to a song that really ramps up your beat and really gets you going when I'm just starting a race that I'm not going to finish for a couple hours because like that's just going to like
Hmm.
burn me down. Like
Right.
I don't need that now. I need that for like the end, but how important that is because of it can do that, right? Like it can really set you off into like this this moment of like, all right, here we go, and then all of a sudden like it's gonna burn me out before I even get to where I need to. So that was
Mhm.
fascinating though to see that because it's just one of those things that we know has an impact. And I like how you spoke to the journey part of it, but also the biological part of it because it is listening to music and that does do something, but then also the journey part of it. So I kind of like that the components of what it adds. So
Mhm.
one final question before we kind of wrap up here is when I look at some of the stuff that you're doing and offering, and we talked about the history of some of these things and where it's been before and where it's been going. When you look at what you've seen and what you're seeing now, but also what you're anticipating or what we're noticing going into the future, what do you think is going to be really important for people to know as we continue to treat addiction and mental health, knowing things aren't the same now than they were before. In a couple of years, they might be very different. So how do you look at the important things to consider for where we're headed in those directions?
Yeah, I think it's important for people not to feel shame about what they are struggling with. I think it's really easy, especially in the age of social media, to imagine that everyone else's life is so easy and simple, and ours seems to be filled with problems and issues that we can't get past, and chronic stresses too. So I think like just no matter what changes human connection and encouraging that. And I see shame and stigma as something that unnecessarily stifles people's outreach to others, whether it's people in their lives that they trust or professionals that they can build healthy, trusting professional relationships with. Um, so I think, yeah, destigmatization, as we were talking about before, is really vital, specifically with general mental health issues, but addiction too, and none of these are personality defects. They are not if, failures of character. I think also that unnecessary shame keeps people stifled and keeps them from reaching out to other folks, and so that really stressing the importance of like outreach, not feeling shame, not feeling like, you are bad for having this problem because then you got two problems, I think it's through outreach that, people can get better, and, we rely on the help of our community. I mean, maybe some part of it is just, Western society is so much about the individual and individual achievement or individual beauty or this or that, but it really could be much more about like working together with others and people lifting each other up too.
I appreciate that because I still run into people who think shame can, create change or shame can be what gets the person to realize they need to change. And I usually tell people, one, um, shame is not something that the people we serve are short on.
Hmm.
They might be short on a lot of other resources or access to things, but that is not one of them. And
Right.
if shame is what did treat this or heal this, um, I probably wouldn't be doing what I do because there's plenty of that goes around. But some people still get stuck on that, like thinking shame will, get someone to change their behavior. They'll get tired of it. And we're still battling those messages even after all these years. So I really appreciate you reinforcing that and sharing that no matter what does change and what other advancements we do have, that this is a piece we always need to be paying attention to and that we can always address right now. We don't need to wait for that or see what changes with that. We can do something about that today, tomorrow, always.
Hmm.
So thank you. I appreciate that. All right. Any last takeaways for audience members, things that you want them to think about after our conversation or, what they could do next? Just any final thing you want to leave with them.
Yeah, I think imagine who you want to be and, be open about seeking help for that. There's no harm. You're only perpetuating a cycle of shame if you don't reach out. So I just encourage people to, seek the help of a professional, certainly. And if and it only starts with an evaluation, there's no commitment beyond just like a single visit, but a great journey begins with one step, and that might just be reaching out to a professional and talking about your issues.
Thank you. I really enjoyed our conversation today, and I think audience members are going to get a lot of the different areas that we touched on and talked about, and your background experience, I think, highlights a lot of insight for people. So I want to thank you again for taking the time and joining us on Talking Addiction Recovery podcast.
Yeah, thank you so much for having me. Thanks for the great conversation.
You've been listening to Talking Addiction and Recovery with Andrew J. Schreier. We're so glad you've joined us and invite you to connect further with the show and these topics at www.andrewjschreier.com. That's Andrew J. SCHREIER.com. You can also email us directly at talkingaddictionandrecovery@gmail.com and connect on social media, Instagram at Talking Addiction and Recovery, Facebook Talking Addiction and Recovery Podcast, and Twitter at TalkAR_podcast. To stay connected and never miss an episode, be sure to like, rate, and subscribe. Until next time, friends, let's keep talking addiction and recovery.